False high pressure reading. A high pressure, but it's false because the transducer too low. Place the venting port of the transducer at the correct level, foramen of Monro. And for every 1-inch transducer is below the pressure, there is an error 2 mm high. Transducer incorrectly. Balance the transducer correctly for correct position. And this should be rebalanced every 2 to 4 hours. Monitoring system incorrectly calibrated. Air in system. Air may attenuate or amplify the pressure signals, leading to high false reading. High pressure reading. This is an actual high pressure reading. ليش ممكن يكون يطلع عندي الاي سي بي عالي؟ airway not patent، في secretion، في زيادة بالintratheretic pressure، ventilator setting، beep that increase intratheretic pressure، hypoxia, hypercapnia, all of these increase ICP. Posture. Head should be elevated 15 to 30 degree. Head and neck should be positioned to facilitate venous drainage. Limit knee flexion. Excessive muscle activity. Muscle relaxant could be used. Hyperthermia. Excessive muscle activity increase susceptibility to infection. This may increase also ICP. Fluid and electrolyte imbalance. Draw blood for serum electrolyte. Note pulmonary artery pressure. Evaluate input and output and urine specific gravity. Blood pressure. Vasopressor response occur in some patients with elevating the ICP. Use measure to maintain adequate and continuous positive pressure. Low blood pressure associated with hypovolemia, shock, barbiturated coma may increase cerebral ischemia because the perfusion to the brain may decrease, will decrease. False low pressure reading. This could be to reading air bubbles between transducer and CSF. We have to eliminate the air bubbles with sterile saline. Transducer level too high for 1-inch high, 2 mm low reading, which is an error. Low pressure reading. Actual low pressure reading could be too zero or calibration incorrect. Collapse ventricle around the ventriculostomy. Check to make sure positive pressure of 15 to 20 mm exists. Drain CSF slowly in order to avoid low pressure reading. Otorrhea or rhinorrhea, and these may lead to decreased CSF and leading to low pressure. Document the correlation between the drainage and the pressure change. High drainage, low pressure reading. Slow drainage, good pressure reading. Leakage of fluid from connection. We have to eliminate all fluid leakage. Dislodgement of the catheter from ventricle into brain. Contact physician regarding the appropriate diagnostic studies and intervention. Occlusion of the end of the subarachnoid screw by the necrotic brain. In some cases remove screw. ممكن يصير في انسداد في أحد أجزاء الجهاز هذا عند السكرو وبالتالي يصير في low pressure reading.